At precisely 9:17 a.m. this past Tuesday, the United States took a step that will redefine public health for an entire generation of children, and not in the way anyone expected. Not through scientific breakthrough, not through bipartisan consensus, but through a quiet bureaucratic maneuver that bypassed the very experts charged with protecting our kids. The Department of Health and Human Services, under Secretary Robert F. Kennedy, Jr., just overhauled the CDC's childhood immunization schedule, slashing universal vaccine recommendations from 17 diseases down to just 11 core shots: flu, rotavirus, RSV, hepatitis A and B, meningococcal. These are no longer routine for every child. They've been relegated to high-risk only or shared clinical decision-making, a code for letting parents and pediatricians opt out based on vague personal judgment. I've covered American institutions for 5 decades, from Watergate to pandemics, and I've never seen a policy this audacious slip through without so much as a public hearing. Every detail of this change was captured in the official HHS decision memo, leaked press briefings, and the stunned reactions from the nation's top epidemiologists. And I'm going to walk you through it all, because the stakes aren't theoretical. They're measured in preventable deaths, hospital beds, and the slow erosion of herd immunity that has kept deadly diseases at bay for decades. For 30 years, the CDC's Advisory Committee on Immunization Practices, ACIP, the gold standard of independent science, has meticulously vetted every vaccine on that schedule. They pore over clinical trials, efficacy data, safety profiles, and real-world outbreak stats. It's not perfect, but it's rigorous. Randomized controlled trials with tens of thousands of kids, post-market surveillance via VAERs and VSD, longitudinal studies tracking adverse events at rates below 1 in a million doses. The old schedule protected against diphtheria, tetanus, pertussis, polio, measles, mumps, rubella, varicella, hepatitis B, pneumococcal disease, and Haemophilus influenzae type B as universals, plus rotavirus, flu, HPV later on. Compliance hovered at 93% for kindergartners pre-COVID. Result? Measles cases plummeted 99.9% since 1980. Whooping cough deaths near zero, but vaccination rates cratered amid pandemic mistrust, down to 92.7% for MMR nationally, with hotspots like Kentucky at 89%. Exemptions hit record highs. 3% non-medical in 2024-25. Outbreaks followed. 1,200 measles cases in 2025 alone, the highest since 1992. Pertussis surging in 18 states, claiming 6 infants last fall. Enter President Trump. In December 2025, he directed HHS to benchmark against peer nations. The review, conducted internally, no ACIP involvement, found the U.S. recommends more doses than Denmark, 11 universals, Sweden 10 or the UK 12. Denmark's lighter load works in a universal healthcare utopia, 100% primary care access, robust surveillance, cultural trust and authority. America, fragmented insurance, 28 million uninsured kids visits skipped annually. Rural deserts without pediatricians, yet HHS adopted the Danish model verbatim, effective January 4, 2026. No vote, no comment period, just a fact sheet and a press release touting trust building. Let me lay out exactly what changed, because the numbers reveal the gamble. Rotavirus used to be universal for all kids, 2 doses, that prevented 2.7 million cases and 55,000 hospitalizations every year. Now, shared decision-making, meaning parents can skip it after a chat. Influenza shots from 6 months old, gone from routine, high risk only, despite avoiding 20,000 child deaths annually. RSV protection for vulnerable infants, downgraded, even though it spares 58,000 to 80,000 hospitalizations in kids under 5. Hepatitis A, 2 doses for everyone, now high risk only. After preventing 100,000 cases yearly, hepatitis B at birth plus boosters, averting 25,000 chronic infections, shared decision-making, meningococcal at 11-12 years, stopping 400 cases and 50 deaths. High risk only. HPV, 2 or 3 doses from age 9, projecting a 90% cervical cancer drop by 2035, slashed to 1 dose under shared judgment. The core 11s stay locked in: DTP, IPV, MMR, varicella, Hib-PCV, and the rest. Savings minimal. Vaccine costs are pennies compared to outbreak tabs. A single measles epidemic costs $3.6 million per 100 cases in quarantines, ER visits, and lost wages. Picture the hearing room, or lack thereof. HHS spokesperson: "This empowers parents and doctors." RFK Jr., vaccine skeptic extraordinaire, tweets, "No more one-size-fits-all. Science supports choice. But science." The memo cites no new trials, just comparative schedules. ACIP Chair Dr. Helen Talbot testified post-announcement, "We've seen zero data justifying this." Rotavirus hospitalizes 55,000 U.S. kids yearly. Denmark's rate is half ours, due to demographics, not fewer shots. Michael Osterholm, University of Minnesota's Vaccine Integrity Director, called it arbitrary political theater. Sean O'Leary, American Academy of Pediatrics president, warned, "Shared decision-making sounds benign, but without mandated counseling scripts, it becomes opt-out by default." Pediatricians I spoke with, from Georgia clinics to Minnesota ICUs, report chaos. Confused parents delaying Hep B prevents 25% chronic liver cancer risk, skipping rotavirus amid daycare outbreaks. A Georgia pediatrician shared anonymously, "I treated a 5-year-old meningococcal case post-residency and intubated 3 days. Died despite pressors and every antibiotic. That's the shadow this casts." Judicially, this echoes institutional stress tests. Courts have upheld ACIP independence. Expect lawsuits from AAP, NFID. Politically, states diverge. California mandates all old universals. Texas parrots HHS globally. France 14 universals watches warily. Cervical cancer rates plunging via HPV herd immunity. Denmark, their system assumes compliance. Ours breeds hesitation. Why now? RFK Jr. pledged in February 2025. Senate hearings. No yanking vaccines. Safety first. Yet here we are, anniversary of January 6th. As critics note, the optics administration insists insurance holds, ACA mandates, no copays for ACIP recommended shots, once they covered via VFC for uninsured, but reality bites. Studies from Johns Hopkins show opt-out phrasing drops uptake 20-30% in fragmented U.S. care. Premiums up 30%. Post-ACA subsidy cliff. Low-income families skip optional shots. Black and brown communities already at 85% MMR rates face highest pertussis meningitis tolls. Trump's calculus: rebuild vaccine trust amid 40% parental skepticism, but trust erodes when experts are sidelined. Osterholm poses the question, what diseases do we want kids suffering? History answers: pre-vaccine, polio paralyzed 15,000 yearly, measles killed 500. We've forgotten because vaccines worked. 3 takeaways as this unfolds. First, policy isn't pixie dust. Denmark's schedule thrives on their equity. Ours invites disparity. Second, bypassing ACIP invites peril. Science demands deliberation. Third, watch the data. By summer 2026, expect whooping cough clusters, rotavirus wards filling. This isn't anti-Trump screed. It's pro-prevention realism. I've dissected presidencies from Reagan to now. This pivot risks undoing herd immunity's miracle, substantiated by HHS memos, CDC trackers, Osterholm's models, not headlines. What unfolds next? Track VAERS spikes, state mandates, AAP suits. If this breakdown clarified the mechanics over the spin, subscribe for weekly deep dives. Comments: does choice trump evidence here? I'll cover developments. Stay vigilant.